Good morning. I want to first thank everybody for coming out today. We haven't had a press conference in a while, but this is important topic, so we want to make sure that you help us get the information out to our public. Before we get started, I want to talk about the conversation that I had with the governor this morning. We all know that the numbers are rising on the last few days that we've seen, and I don't want to say a spike because we don't know if it's a spike, but the numbers have increased. And so what I want to ask the very public, as well as all of you, to help me get out the message that we must continue to be a community, we must continue to work together, and Clark County, business industry, OSHA, we will all be out in force to ensure that everybody is doing their part. We are one big, resilient community of 2.4 million people, and we can do this. But if we don't do this, we're going to have to go backwards. And I'm not wanting to do that, nor does anybody else in this valley want to do that. So I am telling you that today, I'm going to be a little bit stricter, a little bit harder on folks, because for those that are not complying and those are not helping me, as long with everybody else in this community, there has to be consequences, right? So if you value your business and you value the public safety and the public health of everybody, please step up and do your part. I know that it's not comfortable for any of us, but we're all willing to do it. So I will tell you, I've been out to many different places over the weekend. Some are at 99% compliance, some are 12. We all have to be at 99% compliance to get to phase 3. So I am asking you as the press, I am asking you as my colleagues, I am asking you as my constituents to please help us ensure that we can stay in phase 2 and that we can move on and get back to a sense of normalcy. So with that, I'm also going to say that social distance does matter. We've seen that. You asked us in the very beginning when we were in phase 0, how do you know it matters? Well, because we've seen a dramatic decrease in numbers. We've seen people that were practicing it wherever they went. We've seen that people were taking notice of it. And honestly, 3 weeks tends to make a habit. I don't know what happened to that habit. We all have to get back to that habit. Secondly, we're asking you to wear a mask, and we're asking you to wear a mask as we have been from the very beginning in phase 1, because we know that the spread happens. If it's a cough, if it's a sneeze, we want to ensure that it stays closely. So I am asking one more time, and I'm going to ask every single day, 50 times a day, because I love this state, I love this county, and I want to see us thrive. I want to see us get back to some sense of normalcy, but I can't do it today if everybody doesn't do their part. And we are better than this, and we will do that. So on that note, I told the governor that I am confident that our community can get it together, and I will put whatever resources behind the health district who needs to get contact tracing, disease investigators, all of that, as well as code enforcement. I'm asking all the cities to do that as well. But as residents together, let's tell on each other, because we want to save everybody for the long term. So with that point being made, that's how I started my morning, so I want people to start thinking about it. The reason that we have you here today is because we have seen an increase, and we want to make sure that folks understand exactly what's going on. But before I do that, first and foremost, I want to thank all of the people on the front line that are working very hard, whether it's those that are fighting the fire at Mount Charleston, whether it's our employees that are going back to work and making sure that we can continue to grow. I want to thank them for what they're doing, because they're doing a phenomenal work. I also want to point out that this is a collaborative effort across the community. So Commissioner Naft is here to show his support and to do what he can. Commissioner Sagerbloom is here. He represents a portion of the east side. Commissioner Gibson represents a portion of the east side as well. Councilwoman Olivia Diaz, we've worked together before. She represents a portion. So all of the electeds are coming together, and there's a lot more that you'll see in the future. So my colleagues for coming together during these very important times. So today, I'm going to give you kind of a rundown of what you can expect. So I'll start with some opening remarks. Dr. Legon, who is my BFF because we spend so much time together, will give us a report on the health district on what we're seeing. Commissioner Sagerblum will talk about some of the testing status and efforts. Commissioner Gibson will help on the Spanish speaking. He's very fluent in that, so we're excited. Councilwoman Olivia Diaz is going to talk about our overall campaign. Alyssa Cortez is going to give you some real heartfelt on what it means to lose somebody during COVID-19. And then Dr. Medina, who we rely on heavily to help us with our medical experts. So for all of you that know out there, we have a great medical team across the state that we work with. Locally, we probably have the best between the health district and UMC. So all of our thoughts have some public health behind it. But I want to remind people today that as we go into the 4th of July weekend, we more so than ever have to practice that social distancing. And it is possible to have friends and family over and still social distance. I don't know that we need to sit on top of each other, next to each other, as much as we can sit back, stretch out, and get comfortable. What I don't want to see this weekend is thousands of people going out to see fireworks, standing on top of each other, conversing, having a great time, because that is not going to be beneficial for our community for the long term. So I want to ensure that everybody understands that importance of social distancing, and also by wearing your mask, that is an additional layer we can give to our community. We've talked about the numbers a little bit, that they're rising. I think we're going to go into the details. It's unfortunate that our Hispanic community is seeing the brunt of those numbers. As you all know, in the beginning, we started with our older population. We're the most vulnerable. We worked very hard as a community. We got that into order by June 1st. We had tested every single assisted facility center within the Clark County Valley and across the state. So our seniors are actually at the low end of the numbers today. Secondly, we've seen as we went into phase 1 that the African American community was impacted. So we quickly stood up strike teams. We went out, we tested, we educated folks on all the things that we needed to do, and we've seen their numbers decrease. Today, we're here because the Hispanic numbers are growing, and we have to get a handle on it together as a community. And we have to remind people, we have to educate people on all of the things that you should be doing. So with all of that, and I thank you again for coming. We'll be here to take questions and answers, but this is a great community. We can do this. We are resilient. We are strong. We always make it back. And I am counting on all of you to do your part. So with that, I'm going to go ahead and introduce Dr. Legon.
Thank you, Commissioner. Good morning. First, I want to say that we have experienced an increase in coronavirus cases in Clark County for the last 3-4 weeks, and this increase has been more evident per population, mostly individuals between 18 and 49 years old. That's where the bulk of the increase in cases is in our community, which is, of course, is a young population, and also is socially active, and of course, is the people who also are more likely to be at work, school, and other activities out there. In addition to that, we also have seen an increase in the Hispanic population in terms of cases. Right now, the Hispanic community is the one with the highest rate of coronavirus in this community. Coronavirus incidence in Hispanics today is twice as much as what we see in the white non-Hispanic community. This is something that is a reason for concern to us. Also, it's a reason for concern because this is mostly a younger population. Usually, that segment of the population is very resistant to preventive messages because, I mean, when you are at that age, you feel that you are very strong and nothing happens to you. Also, we have seen with this disease that the people who are more severely affected are the older population. And that kind of explains why, despite this increase in cases in that group, we haven't seen a consistent increase of hospitalizations or deaths. And the reason is because right now that increases in a younger population. But again, the Hispanic community has been the one more severely affected by this increase. Part of the reason for that increase in the Hispanic population is related to the social and health disparities that this segment of the population experience. Hispanics are more likely to be engaged in works related to industries that require a higher interaction with the public, such as grocery stores, healthcare work, or the service industry. We want to emphasize that for the Hispanic population, as saying that the rest of the community, is very important to follow the preventive recommendations in terms of social distancing, the use of masks, avoiding large gatherings, especially like we have seen in some of our investigations, some cases related to parties, with, and something that shouldn't be at this time. I also want to mention that the health district has been partnering with the county and the state in terms of increasing our contact tracing capacity. We received yesterday 16 members of the National Guard that start training with us to be deployed in contact. Also, the county provided to us 20 employees who will be trained this week and will be participating in our contact tracing response. Also, I want to mention that those county employees are bilingual, so they will be able to directly communicate with the Hispanic population and providing messages in terms of the social needs that they might have, and also address the issue of the contact tracing. I want to say also that for the whole community, we have an electronic system that allowed us to communicate immediately with the person who becomes positive for coronavirus. And once we receive a lab result, we have a valid phone number from that person, and we send them an electronic message. I want to ask everybody to please do not disregard a message that you might see in your phone from the health district, because that's a message that actually starts our investigation process. And then I also, just to finalize again, I think it's very important the directive from the governor about the use of masks in public places, and it is important because it emphasizes how critical for this community it is for us to be aware of the value of using masks, especially when we are in public places when there is not enough space to social distancing, and also because this directive increase awareness in the whole population about all the preventive measures that we need to take in place, not just the use of masks. And I will stop here. Okay. Now I will introduce Commissioner Zuckerman, please.
Good morning. I want to talk briefly just about testing itself. As you know, one of the critical elements here is knowing who has it and who doesn't have it. And one of the problems we've had in the Valley and in the country really is the lack of testing. But truthfully, in Las Vegas, that is no longer an issue. We are starting today, and actually starting the last couple of weeks, we're putting a full court press on the east part of the Valley to make sure there are testing facilities everywhere. And that word needs to go out. But you will be noticing about that as far as where the testing facilities are. They're going to be at schools. There's going to be a permanent facility at Winchester. There are going to be strike forces at different Walmarts. But the fact is the testing will be there. We've done 50,000 tests to date in the Valley, but that's going to really ramp up. But I just want to remind people that you can be tested. Testing is free. You don't have to be a citizen. You don't have to prove documentation. All you have to do is contact one of the facilities. There'll be places where you can just show up. There'll be places where you have to get registered ahead of time. But there'll be websites. There are going to be flyers and all around the Valley. But the fact is, testing is there. So if you have been exposed to someone, or think you've been exposed to someone, or feel symptoms, please do not sit back. Go reach out. They're reaching out to you to tell you how to get tested. And the other thing about this is we're asking the press to really help us with this. It's so important that you publicize where these locations are and do PSAs and things and just encourage people to come out, because it is so critical that if people think there's a problem, they get tested. Don't sit around and worry about it. It's critical that we stop this thing right now. We can't let our economy backslide. We need everybody to participate in this. All the citizens, all the politicians, all the interest groups, and mainly the press. So with that, I will turn it over to Mr. Gibson, who is actually, is he coming up? Oh, I'm sorry. I'm going to turn it over to Councilwoman Diaz. Mr. Gibson, I want to point out, is reaching out to the church groups and other interest groups in the East Las Vegas to make sure that they are advised of this. But he will be speaking during the Spanish portion. But our City Councilwoman Diaz will now speak. Thank you.
Thank you, Commissioner Sager-Bloom. Thank you, commissioners, for all the hard work you've been doing to ensure the safety and well-being of our community. It is of utmost importance that we do not lower our guard against COVID-19. Things had not gotten worse because we were staying in place, we were staying with our families, we weren't going to work, and we were maintaining our social distance. And then something happened on Memorial Day weekend. We all felt like COVID was no longer a threat or it wasn't around, but that's not the case. The virus is still amongst us, and we need to take proactive measures to ensure that it doesn't affect us, my family. For example, I feel for all you parents. My 9-year-old yesterday asked me, "Mom, can I please go to my friend's house and play video games with him?" And I had to be the strong, firm mom and say, "I'm sorry, honey, but it's still not time for us to go to other people's homes. We have to make sure that we keep them safe and that we keep ourselves safe." And then today, to boot, I have my grandbaby born, and that thought of a fresh new baby and making sure that we're protecting that new life that's amongst us, we have to do everything we can. And I'm so confident that we as a community, like Commissioner Kirkpatrick said, will continue to band together, because it really is in our hands. Está en tus manos estar sano y saludable. So it is in our hands to take care of ourselves and our loved ones. This initiative, Está en tus manos, it is in your hands, is an initiative to educate everyone but in particular our Hispanic community, about the alarming and devastating rates of COVID-19 here in Las Vegas that we are seeing that are disproportionately impacting our Latino community. The importance of actions to limit the spread of the virus, because there are things we all can do to limit the spread and ensure that we are healthy and we are well. There's also going to be details provided to everyone who goes to this website, estaentusmanosnevada.com. There will be details for free, easy, safe testing. How do you get there? Where is the nearest testing site to you? Maybe there's a neighbor or a coworker that doesn't know where to go. This is a time where we help facilitate and disseminate this information so that we can take care of each other. There also will be a lot of financial assistance and wraparound services available to those that need it, especially those who test positive with COVID-19. So we shouldn't be afraid. We shouldn't be afraid to get a test if we've been working. We shouldn't be afraid if we feel symptoms to go immediately and seek that test, because we know that this virus is highly asymptomatic, and we need to make sure that we get tested so that we don't then take it to our workplace, to then those co-workers might be exposed and take it to their homes, and we could see how easily this little chain can set off. So the Clark County, Southern Nevada Health District, UMC, elected officials, some of which are not here, but I know the Hispanic Caucus has been taking a very active role as well as our local community, businesses, including grocery stores and faith leaders. We have all come together to launch this educational campaign targeting the Hispanic community. There will be a heavy emphasis on stakeholder engagement with faith leaders, businesses, and local organizations, reiterating key messages to our community about things that we can do, as simple as wearing this face mask. It doesn't have to be fancy. It could be a scarf, it could be a bandana, it could be anything that I have to just make sure that I'm covering my nose and my mouth so that if I'm asymptomatic and I'm a COVID carrier, I'm not putting others in harm's way. So again, don't be afraid to get tested. We want to make sure that you have all of the resources at your fingertips, and you're going to be able to get that right here from this website. Our community has the resources to help everyone who needs the help in our community. Estaentusmanosnevada.com is a Spanish language webpage with the latest information about community resources, testing sites, face covering examples and videos. We will show a 30-second Spanish language public service announcement with English subtitles that we'll share via partners and on social media. So are we going to share it right now? So let's go ahead and just take a look at what that PSA sounds like.
El coronavirus no es un juego, es real y mata. Muchos hemos seguido las recomendaciones sanitarias y mantenido el distanciamiento social, pero lo cierto es que las cifras de contagio en la comunidad hispana es la más alta y sigue creciendo. No busquemos culpables. Por el contrario, es tiempo de comprender que tú tienes el poder de cambiar esta situación. Ese poder que te impulsa cada día a luchar por los que más quieres. Recuerda, al protegerte, los proteges a ellos. No bajes la guardia, que el virus sigue entre nosotros. No puedes verlo, pero cuidándote, puedes detenerlo. La solución está en tus manos.
So that is the PSA that we hope that the media can help us also get out there. Please help us make sure that the community knows está en tus manos, it's in your hands. And encourage family, friends, coworkers, and organizations to do the same. We just want this to be disseminated and distributed amongst everybody's channels. We are working with our partners to get the message across in the Hispanic community that everyone needs to wear a mask in public places where social distancing can't be maintained. I know it's not a fun thing to do, especially in the hot July month, but it is necessary. It is a key preventative measure that can keep us healthy and safe. So we need to do it not only for ourselves, but for everyone else. We do need to make sure we're limiting the size of social gatherings. So I'm particularly concerned, like Commissioner Kirkpatrick, with 4th of July coming. Yes, we can get together, but do the size of the people that you invite over to your home to be appropriate with social distancing norms and guidelines. So if your house can accommodate 20 people with appropriate social distancing, great. But what we don't want to see is hundreds of people in a tiny little house that it just wouldn't be safe for everyone to kind of hang out this go around. And also make sure that you get tested. If you are in a massive party for some reason this 4th of July, or you are exposed, get tested right away. It's so important that you seek that test and we know those results so we can continue to keep you, your family, and the community safe. Wanted to also put a plug here. We have great partners in our community. The Latin Chamber of Commerce is helping distribute masks on the east side. They have their offices right there in my ward off of Maryland Parkway and 13th, I believe. And so call the Latin Chamber of Commerce ahead of time to make arrangements to pick up your masks that you and your family may need. Many Hispanic families in the Las Vegas Valley do live in multi-generational households, so we need to make them aware that if one family gets the COVID-19 virus without knowing it, that the disease can be brought home to the parents and the abuelitos in the house with very terrible consequences. So please, let's make sure we're watching out for everyone in our homes. And with that, I have the difficult task of inviting Alyssa Cortez to share her own life experience. That's probably one that we all don't want to be touched in during these times, is losing a loved one to COVID-19. Alyssa is 22 years old. She's a native Nevadan, and she recently lost COVID-19, and she will share remarks about her uncle Everardo Cortez, who at just 41 years of age lost his life.
Hello, everyone. My name is Alyssa Cortez, and I'm here to share the story of my uncle, Everardo Cortez. He passed away a short 6 days ago, and considering his young age of 41 and the birth of his newborn baby, it has been an especially difficult time for our family because it was such an abrupt loss, and it's been especially difficult to cope as well. So we can only hope that his story will encourage others to take the steps necessary to prevent the spread and deaths that come from COVID-19. When he was admitted into the hospital, things spiraled out of control, and it attacked his lungs and other critical organs. And I just want to ensure that our community listens to these stories so they understand that the young can also be vulnerable. And the saddest thing for me is that he has left behind 4 children that will no longer have their father in their life, and his wife as well is also suffering greatly. So I'd like to thank you for listening and to remind you all that it's in your hands and that you can prevent the spread of the coronavirus. Thank you.
Now we'll have Dr. Medina come up, please.
Good morning, everybody. I'm Dr. Luis Medina Garcia. I'm an infectious disease physician with University Medical Center, and I'm proud to be here today. Thank you for having me. The message I want to give you today is one of encouragement. Encouragement to continue the fight among all the challenges that we face. Everybody has made great efforts to get us to where we are today, anywhere from the public health initiatives to isolate, to reduce the speed of the transmission of the virus, to increase the testing capacity to unprecedented levels. We are lucky in every way as compared to many of our neighboring states to be able to have such resources. At the beginning, we started doing some teletown hall meetings to kind of create information and disseminate information to the general public about why this was such a dangerous disease and what we could do to protect ourselves and the ones we love. And one of those things that we mentioned was, whenever we start opening up, we need to do it carefully, we need to do it slowly, and we need to think of our loved ones, because we don't want to undo the gains that we achieved. We are seeing an increase in the amount of cases, as is the rest of the country. But just like we were able to band together at the beginning, we can do so again. I invite all of you to become part of that fight, to do your part to stay healthy for Nevada. Wearing a mask is something that has been an issue of contention nationally, and it's discouraging as a physician to see a lot of people fight that requirement. I find it not a limitation of your liberties, but a sign of your fellow citizens. The mask that I wear doesn't protect me so much as it protects those around me, and I feel it my civic duty to do that. It's difficult to not forget that you are fighting something that is invisible to you. But just because you can't see it doesn't mean it can't hurt you. Family is very important for Americans, and we're all Americans. Wearing a mask doesn't make you any less American. It makes you a better American. The Hispanic community has been affected disproportionately for many reasons that Dr. Ligan and everyone else has mentioned. But we're also very family-oriented, and we care very much for each other, and we will do whatever it takes to make sure that we keep each other safe. So wear your mask. If you feel ill, find a place to get tested. We understand that nobody wants to hear bad news, but you must know, because if you know, then you can do something about it to protect yourself and the ones you love. All of the resources made available by our local government are there for everyone, and they're available all the time. The community test sites have been testing an enormous amount of patients, averaging about 1,500 patients per day at each test site. And we have seen an increase in the numbers, as Dr. Ligan mentioned. Although we haven't seen a statistically significant increase in the amount of hospitalizations and ICU stays, we need to remain vigilant and be ready for that. Unfortunately, some of our neighboring states have had a very hard time. Arizona particularly is having a hard time. But we rely on everybody's cooperation to make sure that we keep this under control. Nevada is all about hospitality and family, and we need to continue those efforts. Physical distancing is something that's hard to bring to mind when you're out and about, because we're so used to just living our lives the way we usually do. But just as a visual representation, this is the minimum amount of space that you should have between each other. And it's not a rude thing for you to ask someone near you to please keep their distance for the health of everyone. So with that invitation to participate and contribute all you can to prevent the spread of the virus, I will open it up to questions to Commissioner Kilpatrick.
So I'm going to go ahead and close by saying that we are a great community. We will do this together. This is one more step. As you know, we've been through this since early March. We want to ensure that we continue to make public health our number one priority. So we're going to go ahead and take some questions, and then after that, I'm going to turn it over to Commissioner Gibson, who will facilitate the Spanish-speaking only press conference. Okay, so if there's any questions, just let me know who they're for, and we'll bring them up. Shay.
That is reflective in just
So I'm going to repeat Shay's question for everybody else. So the question for Dr. Lagon is, and then I'm going to step to my left, Dr. Lagon, and you can come up. But the question is, yes, we're seeing an increase in Hispanics, but the younger population is the most concerning. And what do we attribute that to? Is it the interaction in bars? Is there interaction and commingling? I'm paraphrasing for you, right? But just so everybody else knows what it is. So Dr. Lagon.
Okay, thank you. Okay, well, the answer to that question really is a combination of all those elements. Obviously, with reopening of the economy, that allows for a higher level of interaction of people across the community. And of course, with a higher interaction of people, that is also an increase in the risk of transmission of the disease. So that's an element that we certainly recognize. In addition to that, the issue of a lot of people not really using a mask in public places or not respecting social distancing has contributed to that. And when I say people, I will also say businesses, because business owners, managers, they have the authority to actually request that from their customers, and that's something that wasn't happening across the county, and that's something that is important for us to contribute, whether it is individually, a member of this community, making sure that we wear the mask and try to keep social distancing as much as possible, because we are protecting those around us. But also, when business owners or management request that from the customers, that enhance our capacity to be protected from each other, even from those who are not as willing to comply with those measures. So it's a combination of both, I would say.
Yes, sir.
Oh, thank you. Joe Moeller, Channel 8 here. A couple questions real quick. I'm seeing on here that the first date for testing is July 10th through 11th. I guess this might be a question for Commissioner. Are there going to be other testing dates that might pop up before that?
Yes, so Commissioner, I'll let you do the latter ones, but currently today, here's where I'll tell you can go today. You can go to the Texas Station. That is a permanent location site within their community, within their parking garage. You can go to the UNLV Thomas and Mack area. There's a permanent location center as well. You can go to your primary care physician. You can also currently go to the health district, where they also have a location. But I'll let Commissioner Sagerblum, you have some other dates for us?
And also, before you may answer that, is there a push to get testing done before this weekend, being 4th of July? Maybe people can get results. Is that something that is smart for people to do?
I'll let Dr. Lagon answer that specifically, but I'm sure it is. Anytime you can get tested, and the sooner the better. In addition, the 10th and 11th are the start of the schools. There are 4 middle schools that we're going to do weekend after weekend. But in the meantime, we're pushing for permanent sites at Winchester Community Center, force teams that are going to come in too. So that's what I'm saying to you is I don't have the specifics, but if the media will follow us, we will get that out as fast as we can, and then please spread it out, because it really is an intensive push that's going to happen in the next few weeks going forward. And so there's be lots of testing sites out there, lots of opportunities.
I want to follow up on that. So, in the beginning, as Dr. Medina alluded to, testing was a real problem around the country. So we, in Nevada, took extraordinary efforts to invest in the testing, the PPE, to get all of these things together. So we encouraged the entire family to go get tested anytime, anywhere that you can go for the location that's closer to you. So as I said at my own house last night, telling my neighbor, have you been tested? go get tested, and then come back and whine to me about wearing the mask, right? So this is an ongoing thing, and understand that we're in the middle of a pandemic. So people forget, because we shut down in early March, that we are still in the very middle of a pandemic, and we have to ensure that as we come into the flu season, that we're truly geared up and ready, and we know where those sources are. So is it a rush? No, it's a consistent ask for people to take their entire family and please go get tested as often. And if you feel sick, absolutely, first and foremost, stay home from work, but go and get tested. No one is asking questions. We're just asking you to stay on top of it. And it's no different than what we would do with any other infectious disease. So this one, we have plenty of testing. We started out, Dr. Legon will tell you, we started out with only being able to do 40 tests a day. UMC processed 4,000 in one day last week. And with 15-minute waits on the average. So it's easy. Go do it. I'll take one more question, and then I'll let them do the Hispanic one. Yes.
This is Jeremy Chen with 13 Action News. We had a quick question. You mentioned about, the reopening and the spike in cases. We've also received, reports of employees testing positive at their place of work. So we kind of wanted to ask, why aren't employers or businesses required to disclose to the public that they have a positive case of COVID-19 if this employee or someone who works there has had public contact?
So I'm going to let Dr. Legon do that, because that goes back to the contract tracing, because there are HIPAA concerns and there's a whole process. So Dr. Legon, do you want to talk about the HIPAA and how we contact folks that are involved? Okay.
Sure. There is no requirement for a business to disclose that an employee has been diagnosed positive with COVID. When we have somebody who is identified as a positive COVID case, we initiate our contact investigation, and the purpose of that investigation is to find out who are the people who might have been exposed to that case. When it happens to be an employee of any place, then we communicate with management so they know that they have this employee there, because we need the assistance from management in order to start our work with the other employees who have been exposed, and also because of who have been exposed and the case, now they need to go into isolation, home isolation for the case, or quarantine for the ones who have been exposed. So that business is going to be affected by that investigation, and that's what we do. But the business is not required to disclose that to the public unless there is a suspicion of evidence that the public might have been exposed, and we don't have a way to identify who could have been exposed. In that situation, actually, we will go ahead and do a public announcement.
That concludes the English portion of it. So Commissioner Gibson, I'm going to turn it over to you to help facilitate the next portion of this. And first and foremost, everybody have a nice 4th of July. Please help us help you keep our general public safe. Thank you.